Thank you so much for your efforts to transform health through nursing. For 7 years, you've advanced the Institute of Medicine recommendations on the future of nursing and strengthened the nursing field. Because of your efforts, more nurses are advancing their education, taking on leadership roles, and helping make care available for all. You're making a difference for people, families, and communities, and I'm so proud of what you've accomplished. Thank you. Please keep up the great work on the IOM recommendations for the future of nursing. I also want to ask you to continue to build a culture of health, and by that I mean enabling every person to live the healthiest life possible. A culture of health places well-being at the center of every aspect of life so that all communities can flourish and all individuals thrive, regardless of race, creed, income, or location. This is so important to the Robert Wood Johnson Foundation and should be especially important to nurses who see the health needs of our society firsthand. As a nation, we are spending far too much money and investing workforce efforts in trying to fix broken systems, broken people, when we must also act more preventively on a number of levels. That doesn't mean the campaign is changing course, not at all. To build a culture of health, nurses will need to bring the IOM recommendations to fruition. So we need you to continue to advance the IOM recommendations and build a culture of health. In today's America, too many people's health is tied to how much money they make, how much school they've completed, and the neighborhoods they live in. A person's health has a lot to do with the individual decisions he or she makes, that's for sure. But the choice we make are also based on the choices we have. Only 20% of all illnesses can be attributed to biological causes alone. The remaining 80% are caused by the social and economic factors that affect health. Poverty, inequity, violence, poor housing, lack of quality education and jobs, limited access to healthy food, and few safe places to play. Your zip code may be a better indicator of your health than your genetics. For example, babies born to mothers in Montgomery County in Maryland and Arlington and Fairfax counties in Virginia can expect to live 6 to 8 years longer than babies born to mothers in Washington, D.C., just a few subway stops away. If we want everyone in America to be able to lead a healthy life, we need to address all the factors that affect health. We must shift towards a society that places everyone's health and well-being at the center of every aspect of life. We must consider areas that we may not be traditionally associate with healthy living. Think city and urban design, public transportation, education, and social connectedness. We need to partner broadly and with groups that we haven't traditionally collaborated with before. And action coalitions are doing a great job of collaborating with new groups to improve health. They're doing it. The Texas Team Action Coalition, for example, has partnered with the Texas Health Institute to enable older Texans to age in place. Nurses provide expertise and guidance in helping these Texans prepare for end-of-life decisions. And the New York Action Coalition has been partnering with churches to form health ministries that focus on providing health, education, promoting well-being, and improving the health of the congregation and community. Monthly ministries have focused on topics like Men's Health Week and HIV testing, backpack safety, Prostate Health Month, and Allergy Awareness Month. They also offer health information in weekly church bulletins and church bulletin boards. Many of you are already doing similar work that enables people to live healthier lives, and we're asking you to think about who you might partner with in your community to make a bigger impact. Perhaps it's the Y, or your public library or food pantry. If you see a need, consider who can help address it. As a nurse, you have the trust and respect of your community to bring people together to create healthier communities. I hope you'll take a moment right now to consider how you might build a culture of health in your own community. By working together, we can create a healthier place for everyone, and we can leave a lasting legacy to our children and our grandchildren. I'm so grateful to you for sharing your time and talent to advance the IOM recommendations on the future of nursing and to build a culture of health. I thank you.